Hello, everybody. This is Ward Bryson coming to you out of Health Education at the Athens City County Health Department. I am a ComCorps member serving here. That means I'm serving with AmeriCorps, with the specific local corps called ComCorps, which is involved in all kinds of health initiatives. What we're doing today is we're recording our Heart Health series of podcasts, which is a part of our broader health education series of podcasts, which can be found on all kinds of platforms, such as Spotify, Apple, Anchor, YouTube, and others. I am joined by my sound tech, Logan Lambert, who is another ComCorps service member serving at Nelsonville York High School. And I'm also joined today by Dr. James Gaskell. How are you today, Dr. Gaskell?
I'm fine. How are you today, Ward?
I'm pretty good. We did have Live Healthy Kids, which we'll talk about later in the episode later today, and that was a little bit hectic. We were learning about knives with second graders. Mm-hmm. So you can imagine how that is.
Oh my goodness, yes.
And it's your birthday, so really, how are you?
Well, I couldn't be better. I'm enjoying my day.
That's great.
I'm hearing from lots of my friends.
Great.
Yeah, and my children, of course. I've heard from them.
They better really make sure it's a great day.
Yeah.
Can you tell our listeners a little bit about who you are and what you do at the health department?
I'm the Athens City County Health Commissioner. I've been doing this job for 22 years. Before I became a health commissioner, I was in private pediatric practice for 35 years. Now, those weren't consecutive jobs because that would make me really, really old. I was a health commissioner for a few years before I retired from pediatrics, about 5 years. So I went from pediatric practice to continuing on as a health commissioner. For 22 years I've been here.
That's amazing, and we are so glad to have you here, Dr. Gaskell. Now, let's just jump right into our conversation on heart disease.
Since I was a pediatrician, the kind of heart disease that we're talking about for adults I saw very little of. I saw primarily congenital heart disease, but throughout my life I've dealt with friends and also many adults who have had heart disease. So I'm going to talk about modifiable risk factors for heart disease, particularly coronary artery disease. And I'm going to list some of these modifiable risk factors and then offer some prevention strategies. Smoking. Persons who smoke 20 cigarettes daily have a 2 to 3-fold increase in heart disease. Continued smoking is a major risk factor for recurrent heart attacks. You can receive cognitive therapy at O'Bleness Memorial Hospital to help you stop smoking. And of course, there are medications that help, including Chantix. Now, we have a lot of smoking in Athens County. As a matter of fact, we have, as a part of our community health assessment a couple of years ago, we found that in Athens County, 41% of the citizens of our county smoke every day or some days. In Ohio, only 23% of the people smoke. So we have a serious problem in Athens County with smoking, and that contributes greatly to coronary artery disease. As a matter of fact, almost predictably, if young people, and I say people now because women are smoking almost as much as men, but at one time we said men. If you arrived in the emergency room with chest pain and had a heart attack, and you were under 50, highly likely you were a smoker.
Really?
Heart attacks occurred primarily in young people, in smokers. They were all smokers. And if they died of a heart attack at age 45, let's say, pack a day or 2 packs a day smoker. Smoking tobacco has so much nicotine, which is a vasoconstrictor, and it damages your coronary arteries and constricts them all the time. It's not surprising that we would have heart attacks. Same thing happens with vaping. Vaping is associated with high nicotine content. That constricts your coronary arteries, not just your coronary arteries, but all of your arteries, but primarily the damage comes from your coronary arteries. Vaping is associated with a high incidence of heart disease too.
How has vaping introduced that kind of issue into younger populations in the county?
Well, they make it flavored.
Yeah.
Mint flavored, have all these flavors. It's appealing. And it doesn't smell bad. Vaping doesn't smell so bad, whereas tobacco does smell bad. And
For sure.
so it's appealing to vape. And you get a nice high because you get nicotine. It makes you feel happy, it makes you feel good. But it's a potent vasoconstrictor and damages your coronary arteries and then can lead to heart disease. A recent study by the American College of Cardiology found that vape users were 1/3 more likely to suffer a stroke and 56% more likely to suffer a heart attack. Of course, vaping also damages your lungs and leads to COPD and leads to asthma and perhaps lung cancer. I'm not sure that we've been vaping long enough to see what the incidence of lung cancer is, but our society has had vaping for maybe 20 years now, but we'll discover soon whether it induces lung cancer.
Yeah.
High cholesterol levels are associated with coronary artery disease. The Framingham study, which was a study done over 20 or 30 years, a fairly long time ago, looked at various aspects of heart disease. And one of the things they discovered was that if you had cholesterol levels below 150 milligrams %, you hardly ever had coronary artery disease. Cholesterol levels above that were more likely to be associated with coronary artery disease. And of course, that's led to the use of statins. I remember seeing my doctor probably maybe 20 years ago, and he examined me, and my blood pressure was fine, my pulse was, everything was fine, except he said, your cholesterol is about 210, and you need to take a statin. I said, well, how about talking to me about all these good things? And he said, well, your cholesterol's a little high, you need to get it down, and probably you're a pretty busy person, you're probably not going to modify your diet very much, we'll give you a statin. So I took statins for a while, and then my cholesterol came down very nicely. And now I still take statins, but only on the weekend. But I'm like everybody. If you take drugs intermittently, sometimes you forget.
Yeah.
When you take them every day, you remember to take them. But
are statins widely prescribed?
Yes, I think they're widely prescribed.
Okay.
Because by and large, they're safe. They're very safe. The worst that can happen with statins is that you can get some muscular aches and pains. And the people that get muscle inflammation, they usually prefer to give up their statins, but they can use them intermittently, and they'll still work like every other day or 3 days a week or some such thing.
Okay.
So statins are very effective at lowering cholesterol. High blood pressure has been demonstrated by the Framingham study to be associated with heart disease. Even modest increases in blood pressure can increase coronary artery disease over time. By modest increases, I mean, for instance, we like to see perfect blood pressures of 120 over 80.
Yes.
If you go to 140 over 90 over a long period of time, you're more likely to have coronary artery disease and have disease. So, now, that doesn't mean that everybody has to take medication for high blood pressure. You can decrease your sodium intake. You can change your diet, and we'll talk a little later about the things that you can do with your diet. And there are various medications that are safe and effective. The most popular medication for high blood pressure, modest high blood pressure, are ACE inhibitors, angiotensin converting enzyme inhibitors. Can lower blood pressure quite nicely. And limiting alcohol intake helps in that regard too. Obesity has been associated with coronary artery disease, as you might imagine, and often those individuals who are obese have elevated lipids and high blood pressure too. Lack of physical activity. There was a women's health study recently found that walking briskly for 30 minutes 4 days a week was associated with a 30% reduction in vascular events over 3.5 years. Even 15 minutes daily for 6 days, which is only 90 minutes weekly, reduced cardiac events, and that was a women's study not very long ago. Diet can have profound influences on coronary artery heart health.
Yes. This
effect was first observed by Dr. Colin Campbell, who was a Cornell biologist, in 2005. He conducted a 20-year study of 65 counties in China, and he found that there were clusters of persons who ate mostly fish and a plant-based diet, and they had a very low incidence of heart disease and lived well into their 90s.
Wow.
Campbell's study has been quoted and used in the United States for 20 years or more, maybe 25 years. He was the first one that really recognized that a plant-based diet improved your coronary artery problems. A very famous cardiovascular surgeon from the Cleveland Clinic used Campbell's findings to treat recurrent coronary artery disease. Caldwell Esselstyn is famous. He was a cardiovascular surgeon at the Cleveland Clinic. He retired from cardiovascular surgery. He did breast cancer surgery for a while. He was a really well-known man. Anyway, he retired from cardiovascular surgery. He had done bypass surgery, had put in stents, and he found that some of those people that had treatment had recurrence of angina, had recurrence of their chest pain. They hadn't followed a very good diet, and they surprisingly were having angina again. Well, he looked for a way to treat them. They weren't eligible to have more surgery. They'd already had their surgery. They'd had their bypass surgery. They'd had stents placed, and they were having chest pain. And they were likely to perhaps have another heart attack.
Yes.
So he looked for a solution to their problems, and he came across Campbell's diet. These people that live in China to a very old age, 90, with very little cardiovascular disease, and they were on a plant-based diet, and they ate a lot of fish. So he started to treat them to see what would happen. He was pretty rigid. He didn't let them have milk. He didn't let them have oils. He wrote a book about it. And the name of his book was Prevent and Reverse Heart Disease Using Change in Diet and Lifestyle. He advocated a plant-based diet of fruits, vegetables, nuts, seeds, whole grains, legumes, and beans. No milk permitted. After a few months, these people that were having anginal chest pain, you know what angina is, it disappeared.
Wow.
I heard him speak at Ohio University. He was a remarkable man, very capable, bright man. He had won a gold medal in rowing during some Olympics years ago. His wife was a dietitian, and she provided the recipes for this plant-based diet.
Mm-hmm.
Esselstyn showed us a series of angiograms. Angiograms are studies where you put dye into the heart and you see how it goes into the coronary arteries. You see a picture of the perfusion of the coronary arteries. So he had before and after pictures. He had pictures that were the people that had bypass surgery and they'd had stents, and he showed obstruction. They'd had recurrent obstruction, probably because they had high lipids. They didn't have a very good diet. Probably genetics had something to do with it too. I mean, this is a genetic disease in part. He showed studies, and then he showed studies 2 years later. It's incredible. Without any surgery, without any medication, their coronary arteries were clearing, and were cleared, some of them, just with diet. It was remarkable. I must say I was surprised, because I couldn't imagine dietary changes making that much difference. But he had before and after coronary artery studies. Now, I must say that a few of the people who had really high lipids, he did give them statins, like Lipitor and some of these other statins were available, but only the very worst did he do that. But he lowered their cholesterols by diet, and some of them with statins, and that by itself cleared the coronary arteries of obstruction. So I'm convinced that for people who have cardiovascular disease, that really is an important mechanism, protective mechanism and treatment mechanism. As a matter of fact, Caldwell Esselstyn was in Athens and talked to one of my very good friends, Tom Kostouris. Tom was so impressed by his studies that he developed a program called Live Healthy Appalachia. You've heard of Live Healthy Appalachia, and
yes.
they're still working.
We'll be speaking with them soon, actually, for another episode of this podcast.
Well, they're a wonderful organization. I don't know if Tom is still associated with them. I was on their board for a few years, and I think they're probably about 10 years old now. And they're still working, and what they do is provide advice regarding healthy diet, plant-based eating. They have a kids program too.
Live Healthy Kids.
Live Healthy Kids. Very effective program. And I honestly think that this is a very healthy way to live and a very healthy way to protect your coronary arteries. And for some people who have, let's say, a genetic predisposition to have coronary artery disease, it really is a way to save their lives. So I've been, I was just profoundly influenced by listening to Caldwell Esselstyn speak. And my friend Tom Kostores had breakfast with him and developed his program.
That's amazing. I'm actually curious because you mentioned that the original population that he had looked at in China, they did eat fish.
Yes.
And then in his study, they did not.
They did not.
Do you know if there's been any future work about?
I don't know about the fish part.
Pescatarian diet?
But okay. For me to make the diet palatable, I would probably eat fish. I eat an awful lot of fish myself. I mean, I've sort of taken that, but I'm not a plant-based person.
Mm-hmm.
I haven't quite gotten there, but I believe in it. I believe that the people that have the trouble or have it in their family, that they're likely to develop coronary artery disease, is a really thoughtful approach to preventing coronary artery disease, and if you already have it, perhaps for treating it.
Definitely. Well, and I think there is a question of access. Like you say, you don't go plant-based. I don't go plant-based. But I think if we strive to maybe are like 90% plant-based, and we like really reduce our meat intake.
Well, I certainly have done that. I don't eat as much red meat as I used to, and I try to eat more fruits and vegetables. And Ruth constantly reminds me that that's what I should be doing.
That's Ruth Dudding, our Director of Health Education at the Public Health Department.
Yes, wonderful, wonderful asset to the health department.
For sure. And it seems like you're doing all right for yourself, Dr. Gaskell. It is your birthday today. Do you mind if we ask how old you are?
No, I don't mind at all. I'm 84.
84, and that's on a healthy diet. That's avoiding these smoking and being fit. I'm assuming you're a little bit active still. Yeah,
I play golf. I walk my dog every day. I don't run anymore. I used to run, but I had neck and back surgery that made me. I stopped running when I was maybe 6 or 7 or so. But I walk every day. That's one of the ways to make sure that you have exercise. Get a dog. The dogs need walked. They're happier if they're walked, and that's one way to force you, if you will, into walking. Because many people, say, "Boy, I need an exercise program. I really need to do that," and they can't get around to it. Well, if you have a dog, you almost have to get around to it in order to have a dog that's happy, because they like to be walked. And so, I often suggest particularly to my older friends, when they complain about not getting exercise, I say, well, get a dog, and that'll encourage you.
There is kind of I've talked about this with other people, a social pressure to going and like committing to lifestyle changes. And I think that's what that dog idea taps into, right? Like you really owe the dog time outside, so you have to take it out. Yeah. But I think if someone can't get a dog, they could even really schedule things with someone else.
I think that's a really good idea. And you often see that happening on the place where I live on Lavelle Road. It's a country road, not much traffic.
Yes.
And many neighborhood people gather together. Several of them will walk together without dogs. And some of them live over by the country club, and they come across Route 56 and then walk Lavelle Road, which is not a very populated road. It's safe there. So yeah, I see them walking together. And my wife and I will sometimes walk the dog. My wife and daughter and I will walk the dog together sometimes. But often what happens in our situation is my wife walks the dog in the morning, and of course the dog forgets that a walk has already occurred when I arrive home, put on my shoes and hat, and the dog knows we're going for a walk. So she's ready to go again,
And that doesn't hurt anybody. It's just more time outside.
Right.
I am curious, because you mentioned early on that smoking and vaping and other kinds of tobacco and nicotine use are big contributors to coronary
artery disease.
coronary artery disease.
CAD.
CAD. What are some approaches that public health can take to reducing that kind of consumption?
I think public information and reminding people that tobacco use is associated with coronary artery disease, with lung cancer, with COPD. We need to get that information out there. Public health had a lot to do with eliminating smoking from bars and restaurants. I remember talking to City Council about that years ago and trying to get Athens City to pass an ordinance forbidding smoking in bars and restaurants. That was just sort of the beginning. Maybe it was 25 years ago. They weren't quite ready to do it. And thankfully, within months, the state passed a mandate to prevent smoking in bars and restaurants. And I think that helped a lot.
Yes.
That reminded people of the damage that occurs from smoking, and also protected them from being exposed to smoke in bars and restaurants. I mean, that's a common place for people to have exposure. The Surgeon General's report occurred probably 50 years ago. The Surgeon General's report detailed the dangers of smoking: heart disease, emphysema, or chronic obstructive pulmonary disease, COPD, and lung cancer. It was a beautiful study, and the doctors became very aware of it. I think society became aware of it. But I think that was the beginning of the changes in attitude. But it was just the beginning, and it took a long time because this is a cultural change.
Yeah, and a generational change.
Everybody smoked at one time. I'm a physician. The nurses and doctors smoked in the hospital. It was remarkable. You go to the nurse's desk and there would be an ashtray there with cigarette, a lit cigarette, in the ashtray in the nurse's station. And the doctors smoked like crazy. But then people became more thoughtful about it. First of all, they became thoughtful, if they were in the medical field, that they were not a very good example for society. And they also began to recognize that indeed it was true. The people that we were taking care of had smoking-induced problems. They had COPD, they had lung cancer, coronary artery disease, and they had this history of smoking for a long period of time.
Wow.
So finally, and so things are much better today. Not as well as they could be, because we still have lots of smokers in Athens County, but it's improved a lot.
Well, it seems almost with vaping that smoking has had a pretty major uptick.
Yeah, well, I think what happened, with the vaping issue is that people thought that vaping was different. Mm-hmm. And you weren't, because you didn't smell the smoke, it wouldn't have as profound an influence. Now, I don't think vaping causes as much lung cancer, as much COPD, but it certainly does cause coronary artery problems and heart attacks. Vaping has even more nicotine in it than tobacco.
Yes.
It's really high concentrations of nicotine, which causes constriction everywhere. As a matter of fact, in the old days, we used to be able to tell if somebody was a smoker or not because they were pale. Their face was sort of pale because the vessels were all constricted in their face. And you could almost eyeball somebody and look at somebody and know if they were a smoker or not. Not entirely true, but often.
But it held true sometimes, I understand.
Yeah.
Well, this has been a really great conversation, Dr. Gaskell. You've talked us over, can you just summarize, I think, things to avoid, things to include in your life in terms of being healthy for your heart?
Yeah, well, the things you need to avoid are, you need to avoid nicotine, either through vaping or tobacco. You need to avoid a lot of red meat. You need to eat more fruits and vegetables, and probably fish. You need to exercise. That's a positive thing to do. You need to have either daily or at least 5 times a week some sort of exercise. If you're young, it's likely to be more vigorous exercise. You might be a runner or a biker or some more vigorous exercise. If you're older and your joints are not going to support that kind of vigorous exercise, you certainly need to get out and walk. You need to really watch your diet. Be careful what you eat. Not eat a lot of sodium, eat a lot of fruits and vegetables, possibly fish. Um, you need to, if you indeed have high cholesterol, you need to take possibly some medication for it. If you don't treat it with medication, certainly dietary methods will decrease your cholesterol. All these things are things that can reduce your opportunity or your chances of having coronary artery disease.
Okay. Thank you, Dr. Gaskell, for your time today. And thank you to our listeners for tuning in today. We really appreciate you listening. We hope to see you for our next episode. And we hope you stay heart healthy.